Hello, everyone, and welcome to today's webinar. I'm Angela here, and I'm leading the corporate communications team at Medela, and we are very thrilled to have you join us. So, just some kind of introverts throughout the presentations. You can submit your text questions to our presenters by typing them into the questions pane of the control panel located at the bottom right side of your screen. Feel free to send in your questions anytime. We will collect them and try to address them during the Q&A session towards the end of today's webinar. And otherwise, we will follow up by email. We're excited also to offer you real-time AI translations for this webinar through Interprefy, and you can access the translations through the Interprefy widget by clicking on the apps at the bottom right side of your screen and look for the Interprefy icon. Click the icon to open the Interprefy panel and select your preferred language and from the drop-down menu. So mute the main stage audio if needed and listen to the translated audio stream. With this, I hand over to Thomas Golike, our CEO, and wish you a nice webinar.
Thank you very much, Angela, and also a warm welcome from my side. Hello, and thanks a lot for your strong interest and your participation. And I'm happy that we do have participants from the US. So good morning to you from Europe. Hello, potentially also from Asia, where it's already late in the day. Now, just to introduce myself briefly, I'm now the Chief Executive Officer of Medela for exactly a year. I'm with Medela for nearly 11 years. I call myself a Medelanian. And I'm also from Germany, working in Switzerland, and a proud father of 3, now twin daughters. So I've seen my share and know about the importance of breastfeeding, of lactation, also from a personal background. Now, today, it's very important for us, and we're happy that this gained so much interest. Now, before introducing my colleagues, as you see here, and moving into the topic, I would like to show you a little bit where we are and what we want to explain and communicate today. Now, 22 actually marks the 22 days we already made the changes we want to talk about today. So it's the 22nd day that we changed our product portfolio to actually remove ourselves from the scope of the WHO code. And then please moving to the agenda as the next slide. So here you see what we want to share with you. And fundamentally, we want to focus on the fact that breastfeeding families, breastfeeding is at the heart of everything we do at Medela. So we want to share the journey, how we got there, why this is so important for us, what values guided us. Then obviously we will talk more specifically about the actual portfolio changes to align ourselves with the WHO code. And last and very important for us, we want to also share what our current research focus is and why this is so important, because it will open new doors for innovation and it will enable us to actually deepen the research, our commitment to breastfeeding and lactation, in the end to elevate the standard of care in this very important field for the babies. And then a significant portion of this hour we planned is actually allocated to you, our customers, our partners, for Q&A to actually answer the questions you have and give you the opportunity to engage here. Now, please let me introduce my colleagues here, which you see on the right-hand side, and allow me to actually read the credentials as they are important. And I'm proud to have these colleagues here with me at Medela. So first of all, I would like to introduce Dr. Angela Lang, which many of you might already have met. Angela is a clinical nurse specialist with a Doctor of Nursing practice degree. She's specializing in maternal infant health, and with over 15 years of experience in many boards, also as an international certified lactation consultant, her knowledge in breastfeeding support, maternal infant care is extremely high. And she is for us and in general a passionate advocate for reducing maternal and infant morbidity and mortality through ethical, evidence-based practices. And we are very glad to have her with us since 3 years. So thank you, Angela, and you will hear more from her later. Next to her, we have Dr. Nanya Scherer Hernandez. I forgot to say, Angela is working out of Chicago in the US. Nanya is working here in Switzerland as our headquarter. Nanya also brings a strong scientific background. She has a degree in biology, applied genetics, and molecular biology. She works since 15 years, more than 15 years in the medical device industry, and actually joined us even before me in 2012 and spearheaded our development of educational programs and all kinds of knowledge sharing initiatives for the lactation community, ensuring equitable access to the benefits of human milk. You might have had the privilege to participate in any of our symposia. Nanya was pivotal in orchestrating them behind the scenes, providing the high quality research insights for the attending healthcare professionals, and especially focusing in NICU on evidence-based lactation care. So also very warm welcome and happy to have you here, Nanya. And then I'm happy to introduce my long-standing colleague, Natasha Jalu. She actually has over 20 years of experience in the maternal and neonatal care. She's been with Medela since 2007. When I joined in 2014, a lot of what I learned actually is coming from her. And she's now heading the medical affairs function in Europe for us, and very committed to improving the access to mother milks for both newborns and then later babies, establishing standards of care, always looking at the latest evidence and best practices, and also building very strong collaborations with European and national societies in this field. So also very warm welcome to you. Now, at the heart of what we do and want to communicate today is on the next slide. I'm waiting for the slide to come. Here it is. And I'm sure you have seen a letter which in one brief page reaffirms, excuse me, our strong and deep-rooted, it's really at the heart of Medela, it's at the heart of the founding family and all of us there in that commitment to breastfeeding, to lactation, to breast milk. And the why is very simple and clear. It is the best for the baby. And why? Because it improves the health outcomes for mothers and babies. The breast milk has all these benefits, and the breastfeeding transports these benefits. Now, by fully aligning our portfolio to the WHO code, we want and we will strengthen our ability to advance research, education, and innovation solution in that area to support breastfeeding, lactation, and breast milk supply. It strengthens our commitment and focus our commitment there. Now, be assured that this decision is done and taken together by my colleagues in the Medela management team, but also fully supported by our board of directors and also by Michael Larson, the chairman of our board himself. Now, as you saw the number 22, we are already obviously 22 days after July 1st. Now, July 1st was the day when we actually executed this decision and stopped selling the products. But we took that decision already in November. We stopped sourcing, we stopped production, and that led us to the final call now on the 30th of June, and really stop selling the teats and the feeding bottles. Now, this is not a commercial decision. It has commercial impact. It's a strategic decision, and it's all about doing the right thing for the moms and the babies. It's about putting the families in the center of our activities, of what we do to actually provide breast milk and support breastfeeding as a public health matter. Now, we know that breastfeeding is a very powerful intervention, and therefore, by aligning our portfolio with the WHO code, we are also creating space on what matters. And that is for us important, but also for our partners. It's advancing the research, the education, which we continue to do, and the innovation we want to even increase and strengthen to support, and let me repeat myself, breastfeeding, lactation, and breast milk supply. So with these opening remarks, I'm happy to hand over to Nanya to give you more insights to the journey and what took us to this point here.
Thank you, Thomas. Good afternoon, good morning, and probably good evening to everybody. Thanks for joining us today. So our journey to WHO code compliance has been a long one. It's depicted here, it's a long and winding road. Now, code compliance is not about what products you sell, it's about how you market products under the scope of the code. So consequently, in 2020 already, we created our first marketing guidelines. These stipulated that we would not promote our feeding bottles and teats to the detriment of breastfeeding, right? Now, based on WHO's definition of exclusive breastfeeding, this includes expressed breast milk. Our plan was to put our feeding bottles and teats, positioning them only within an expressed milk feeding context. And all our communication should not idealize bottle feeding, nor imply any similarities to breastfeeding. But of course, this was still marketing and promotion of feeding bottles and teats. Therefore, we went further, and last year we updated our marketing guidelines and we created a WHO code policy based on the Access to Nutrition Initiative policy document. Now, the new marketing guidelines that we created in 2024 and the policy stipulated that we would not promote feeding bottles and teats at all, right? We did not have this conditional, we will promote, but not to the detriment of breastfeeding. We wouldn't promote them at all, which is what the code actually requires. To comply with our policy, we changed the images and text on our web pages and implemented changes to the packaging and the instructions for use of our feeding bottles and teats. In the next slide, we can see that, if the next slide appears, a bit of a delay with the slides. Thank you. Our efforts in this respect have been documented. There's this published investigation on the evidence behind feeding bottles and teats in the UK. And Medela was indeed excluded from the study due to the fact that all our marketing materials pertaining to feeding bottles and teats had been removed from our website as per our 2024 WHO code policy. We were, of course, really happy to see that our efforts were being recognized. Next slide. And yet, we have now, no, go back one, sorry. Thank you. And yet we have now gone one step further because we want to provide research grants for lactation, because we want to sponsor healthcare provider conference, because we want to offer education for healthcare professionals and for mothers. Why? Why do we want to do this? Because we do not want to leave this area open to commercial milk formula companies, because we want to tip the research and the education scales of infant feeding towards breastfeeding. Now, although the actual WHO code and the WHA resolutions and the UNICEF and WHO resources on code implementation only talk about companies selling breast milk substitutes when referring to limitation to sponsor research and healthcare provider events, it is a fact that the code is often overinterpreted to include all companies with products under the scope of the code for this matter. So we sought external advice, and the recommendation on the way forward to be able to provide the research grants that we wanted to provide, to sponsor the healthcare provider conferences that we wanted to sponsor, and to educate healthcare professionals and mothers without coming into conflict with the code soon became crystal clear. And it was not to be under the scope of the code by not selling feeding bottles and teats. So here we are today. We've come a long way. And we are grateful to a number of external stakeholders with whom we have worked on this. And we are happy and proud to share with you the statements of two of these stakeholders. In the next slide, you see this is the statement from the Baby Friendly Hospital Initiative in Germany. Certified baby-friendly clinics work according to the WHO code. And yes, the code, the 10 steps, and everyday hospital life can be successfully combined. A full 98% of babies born in baby-friendly clinics in Germany receive breast milk at least once or regularly. We have been in dialogue with Medela for years. Our aim was to work out together how Medela can return to the code. The discussions were open and not always easy, but Medela got involved and gradually made improvements until it was finally right. Congratulations and welcome back. As I said, a long and winding road. The next slide, we have a statement from another of our stakeholders with whom we've been working closely, the International Confederation of Midwives.
Can I interrupt you? There's something wrong with the screen sharing. We need Jess to re-share the screen. So just give us 1 second.
Yes.
Okay, hopefully this is better for everyone. Sorry to interrupt you, Nanya.
No problem. So from the International Confederation of Midwives, midwives support women in all phases of their breastfeeding journey. As ICM, we would like to congratulate Medela on becoming compliant with the WHO Code on Marketing of Breast Milk Substitutes. This is an important step in ensuring that midwives can support women to meet their breastfeeding needs and improve breastfeeding rates worldwide. We look forward to our future collaboration. Now, these are just the statements of two of the stakeholders that have been working with us. We found it important to share this because we think it's also important for other companies that might be thinking about being WHO code compliant, which is what everybody in the lactation world wants, to see that this is possible, that there is a recognition of the efforts, and that there is a way forward. So what are the portfolio changes that have brought us here? And Natasha will lead you through those.
Next slide, please. And good morning and good afternoon and good evening to all of you, dear guests. I would like to give you an update about the products we have discontinued to be aligned with the WHO code. So as you can see, it is the teats, the Calma teats, and all other teats we had, also the feeding bottles. We have also removed the teats which were in product bundles, like in the Harmony Essential Kit. We have also stopped the production of the pacifiers, even if they are not in the scope of the WHO code. In the US hospital, we were not selling the hospital teats anymore since a long time, but now it is all over the world that we have stopped selling them. Maybe also very important to mention that for the sake of saving scrapping, we have reused the bottles we could reuse in some product bundles. Next slide, please. And here you can see the products that are still in our portfolio because they are outside the scope of the code. On the left side, you see the so-called alternative special feeding devices, really meant to be used for special use cases, so not for the general public. The special needs feeder is a medical device. Then you have the soft cup, which is a cup. It's therefore also not under the scope of the code. And also the supplemental nursing system, which is a breastfeeding aid that is used at the breast. We have also still in our portfolio, you don't see it here on the picture, but we have still the finger feeder and the small silicone cup. And also in the US, as part of our NICU portfolio, we have enteral feeding pumps. On the right side, you see storage bottles. They are still in our portfolio because they are an essential part of the pumping system. We validate our pumps with storage bottle to ensure that there is an optimal pump performance. But of course, they are only storage bottle to collect and to store the milk, and we don't sell them with a teat. Next slide. To have everything complete, we are also in the process of changing the two-piece lead to a one-piece lead. In the past, we had the two-piece lead. That is to say, and you can still see it here on the picture, you had a hole to put a teat in it. So we are removing that, and we will have only a one-piece lead so that it is very clear that it is a storage bottle. Next. And also, of course, we have in all our packagings instructions for use. And in the past, we would say that it is the bottles is intended to feed human milk and other liquids of similar consistency. And now in the new instruction for use, you have only the intention, we are writing the intention that it is only to store, transport, and warm breast milk.
Nanya, I just see that Angela had to drop out. There seems to be an issue at our location in Chicago. Would you be able, oh, there's Angela. Yes, I heard that. Angela, can you cover it or shall Nanya do it?
Yes, I'm outside while we're in the middle of a fire. But that's how important this meeting is. So let me just go ahead and start with really this important decision is about reaffirming our commitment to breastfeeding and lactation. And it's really important for us that we continue our mission of turning science into care by advancing research, education, and innovative solutions in this space. Go ahead and hit the next slide, please. And really, at this point in time, especially with everyone who knows what our current environment is in supporting research, now more than ever, it's important that industries also partner with education and research, advancing our unique model of how we support research and our researchers. And one of the things that I think is really important here is that there is a lot of research done by commercial milk formula companies. And what we need to do is have companies who are also filling in that void, doing the actual research on breastfeeding and the importance of the human milk infant triad. Go ahead and hit the next slide, please. And I think this is especially important as we look at many of our researchers that we've worked with in the past have been banned from scientific conferences, also banned from our lactation journals, such as the Journal of Human Lactation. And one of the things Nanya pointed out earlier is that the code is often interpreted as Medela, as a pump company, not being able to fund this research based or go to scientific conferences based on our status with the code. And if we look at what WHO has to say about that, one of the things that are really important here is that this idea that we shouldn't throw out the really good research that's being done just because of this one issue. When I go to the next slide, please. And really, we foster long-lasting collaborations with researchers all over the globe. We've had relationships with Professor Meyer at Rush University for decades, as well as Professor Donna Geddes at UWA. And I also want to point out a really important researcher here is Professor Lars Bodie at the Human Milk Institute in the United States, the only Human Milk Institute. And really how important it is to understand the underpinnings of lactation from a bioscience perspective. All of these researchers, I think when I came to Medela, I learned a lot about their research because I had usually done all of my research through the typical journals that lactation consultants would. And since they are unable to publish in those journals, they're publishing in places like cell biology, nutrients, places that we don't typically look for research. You want to hit the next slide, please? And this legacy from Medela, plenty of you know of our long-standing relationship with the University of Western Australia. What we do is unique. We provide a unrestricted grant to UWA to let them study things that they want to study in lactation. And this has led to a lot of really important scientific discoveries. And things like the two-phase technology or the initiation technology that are in our pumps are really important for helping mothers establish a lactation. And without that essential knowledge, lactation is missing some really important information that can help guide their practice. And I know for me, one of the things when I first started, I had learned about Professor Bodie's research around oligosaccharides. And I thought to myself, Professor Bodie had found this oligosaccharide that was preventative for NEC. And I thought, how do I not know this? I'm a pretty, I read a lot of research. I'm a little bit of a geek. I'm a research junkie. I go to all the conferences. I'm actively involved as a lactation consultant. And it really hit me how important this is that research is disseminated and that lactation consultants know about it. And I think this is really our why. This is the why where we recommended from a medical affairs perspective to the company, is so that this important research can be disseminated. So next slide, please. As well as what we do in medical affairs is our department works outside of commercial interests, and we really just look at how do we educate mothers, how do we educate healthcare professionals so they can provide the best evidence-based support to their practice. Many of you attend our webinar series. I believe that all of our webinars are done without conflict of interest. They're really done to forward science. Next slide, please. As well as we have a lot of activities for engaging mothers in education and making sure that what we do is clinically evidence-based, and we're also helping mothers understand and know how to bring in a full milk supply. And it's, obviously we support breastfeeding mothers and direct breastfeeding as the best way to nurture a baby, but the realities are that some babies are born in NICUs, some babies have separation from their moms. And so really the pump is meant to, and I know for me as a working mother, is a way to connect breastfeeding over time and space. Next slide, please. And so I'll turn it back to you, Thomas.
Well, thank you very much, Angela, and I'm thrilled about your commitment. I really hope there's nothing going on at our site in Chicago. And also, big thank you to Natasha and Nanya. So we are getting closer to answering your questions, and I saw there are a lot. And actually, with this slide, I also want to, or already want to at least address a couple of, I think, recurring questions you have here. Now, this is about what we can do, what Medela can do together with you in the future, and it's all about having an impact And you see there at the bottom, which is very dear to us, and that's where we are refocusing, because when Medela as a company takes stock, it is the science, the research, the knowledge, the know-how, all we brought over 60 years, of more than 60 years to the market, is based on a very strong commitment to research and development. And we want to focus on that. We want to expand on that. And that is the reason why we took stock and said this needs to be in the center of our efforts. And that's why we took that decision. And you see here a couple of things, what we can actually do together. Obviously, rebuilding partnerships, strengthen the connections, but even more important, to really foster long-term research collaborations. Yes, we do have established universities. One of the questions was, why can we not reach also beyond the more high-income countries? Actually, we do with our Medela Cares program, where we also sponsor and support countries who are not so well off to also provide breastfeeding and breast milk. Now, this is clearly not a commercial decision. I also want to be very straightforward with that. The question was, are we actually not making any profit with these products? We did. We are a commercial company. We have to make a decent profit on products we sell. Now, the profit is not always the same, but these products were profitable. But the truth is also they were only a small part of our portfolio, less than 1%. So that also tells you that this is clearly not a commercially driven decision. It's really a decision driven towards what is important to us and where do we want to focus. So in a nutshell, we did this step because we want to build a strong foundation in research, in science, for the better outcomes for moms and their newborns, preterm and term babies. And we want to do that with you as our partners in the scientific and healthcare professional environment there. So with that, I'm hoping that we were able to explain a lot of things. I know there are still many also detailed questions open. We're happy to take them. Probably not all, but rest assured, we will then come back to you in one or the other way. I actually am amazed about the number of interaction, but I think that shows how dear that topic is to you. But I thank you so far for the first half hour for your attention and your patience. And I now turn back to Angela, which will lead us to the Q&A session. Thank you very much.
Absolutely. Thank you very much, Thomas, for giving me the word back. And I'm absolutely delighted to moderate the Q&A session. First of all, Angela, you're a real rock star presenting from the parking lot, but please stay safe. And that's the most important thing. So ahead of this webinar, we actually invited the participant to submit some questions related to our alignment with the WHO code and the recent changes. And thank you everybody who actually took the time and shared their thoughts and concerns. So I think we will start with this. We will address several of the most frequently asked questions, and then also attend to the questions submitted by the audience. And I would say, let's begin. The first question goes to Nanya. I know you explained it in detail before, but why did you choose to align with the code now?
So this has not been a rash decision that has come up right now, right? Over the past few years, we have been working globally to align our practices with the WHO International Code of Marketing of Breast Milk Substitutes. And as I said, all the promotion that we were doing when we were still promoting, we were really trying to make sure that it was good promotion, if you will, right? And right now, this, as I said, we were refining our message, we changed packaging, we changed marketing practices, but the decision to discontinue the feeding bottles and teats and the pacifiers, for that matter, is really just part of this evolution. It's something that started a while ago, removing the products under the scope of the code by recommendation of very high stakeholders from the WHO code stakeholders told us, if what you want to do is the education of mothers, you need to be out of the scope of the code, that the code doesn't apply to you, then you can do that, right? We know, now that I mentioned that, and I've seen that there's a question touching this, education should be done by governments. I totally agree, it should, and it should be free of commercial influence as well. It is not happening. We know that the education for mothers in this respect is poor, and a lot of the education that happens with commercial influence is done by the commercial milk formula companies, and we don't want that. As I said, we want to tip the balance towards breastfeeding. So that was our real goal, as Angela said, this being able to educate healthcare professionals, being able to educate mothers, especially those healthcare professionals that support mothers in the early hours after birth, to be able to use our products and help mothers establish and maintain a full milk supply. But it's been in the making for a long time. Thank you.
Thank you. And I think it's a very important step that we undertook here. But we have also been approached a couple of times if we intend to reverse this decision in the future. And I think this is Thomas, you already mentioned it before, but maybe you can reconfirm the decision.
Absolutely. And just to be 100% clear, this is a non-reversible decision because we believe that is the right way forward, but also because you cannot reverse these decisions. I mean, we communicated, we ended our relationship with our suppliers, we stopped manufacturing. This is for us not even a remote question to go back. We look towards the future, as I said, and we want to build that future based on science and research together with you. That's where we want to do, and that's where we want to make the difference in the market, capitalizing on the science, on the education we provide.
Perfect, thank you. So this is probably again to Nanya. How can Medela be recognized as code compliant by the lactation organizations?
So what we have been doing is we have proactively informed key stakeholders and organizations that uphold the WHO code about our revised portfolio and our commitment. Several have responded positively, as I shared with a couple of statements. We know that many of you are looking to your organizations for guidance. We also know that some organizations are concerned about being among the first to show us their support. At the end of the day, the fact that we have taken the steps that we have taken should be a win for anyone who cares about the code. So we encourage really continued engagement and invite you to share updates within your own networks to support this transition. And we are open to dialogue about the way forward. Thank you.
Thank you. So I would say the next question is for Natasha, and it's about it's actually from our B2C customers, and we have been asked by multiple times how moms should be able to store expressed milk if we discontinue or basically store expressed milk without the bottles.
Well, the discontinuation only applies to feeding bottles and teats, not to breast milk collection and storage containers. So we still have the storage bottles. And for example, in our hospital pump kits and personal use pump, they will continue to include collection bottles. And we will also maintain our range of breast milk storage bags. So these components are essential for breast milk expression and storage and are not affected by this change. So no worries, you can express the milk in the storage bottles.
But then maybe a little bit critical. I mean, how should moms then feed pump milk if feeding bottles are no longer available?
Well, there is a big portfolio in the market, but we are no longer part of the companies who offer these possibilities. And we know from surveys that mothers are quite separating things. When they are expressing the milk, they are looking for the pumps, for the bottles to store the milk, and they are looking on different channels to buy the teats. So they are really having another way of buying than you could think. Yeah.
If I
Yeah, and I
may
just
add
want
to
to
that
add to
one.
that, Natasha, that we've heard from a lot of mothers their frustration or disappointment with us ending the bottles, but we also want to reassure moms that we respect and support all of their feeding decisions. And as a lactation consultant, I work with moms every day. There's individual circumstances, there's geographical considerations, there's a whole range of reasons or different ways that people feed their babies. And so it isn't a decision about how we feel about feeding, it's more a decision of aligning with the code because we think it's important for the work that we do.
Do you think then, sorry, Thomas, you wanted to say something as well?
No, Angela covered it perfectly.
Okay. Do you think that mothers, who cannot breastfeed will be left behind? Angela.
I mean, absolutely not. Medela has always supported mothers for 60 years. We're a science-based company. Our products and services are aligned with that, and we're not going anywhere. This is the brand that really built that trust and deep commitment to supporting every family, no matter what their feeding journey is. And we know that everyone has different circumstances. I mean, I pumped for all of my babies. And I use the pumps in the hospital system for people that need to pump milk. So I don't think that it is leaving our mothers behind. It's really this is an international code that we want to be in alignment with because it's important to all stakeholders in breastfeeding, including lactation consultants and midwives and everyone that we work with. And so it's a way for Medela to go forward in partnership with everyone.
Oh, very nice, very nice. We've also been asked by the audience here, and probably this goes to Thomas. It's like a two-way communication. If we will sell the bottle business to one of our competitors, and also if this decision was driven by declining sales.
The first one, no, we discontinued. We actually scrapped product, as you can imagine. So no, we are not selling that business. And let me make that point that also in the past, and I think that kind of answers the second part of the question. In the past, the business of feeding products was with other companies, as we all know. It was never with the breast pump companies like us, and therefore it's also not really something where many moms will actually miss out of a teat. They are already now, and we know that from research, they're already now buying separate feeding bottles and teats from the many other suppliers we all know, which are then also in close contact with the formula companies. If we just look at the number of feeding bottles and teats we sold in the past, it is just a very small share of babies which are actually getting breast milk. So no, this was not a big business. It did not grow, quite honestly. Why? Because we already in the past didn't support the business for quite some time. We didn't have any new products there, not even any new designs as other companies do. Moms are looking for, I don't know what is the current favorite comic person on these bottles or design on these bottles. So this business was not thriving for us, yes, but for quite some time, and that finally let us just focus on what really matters for us.
Thank you. We have also been asked a couple of times if CRPS will be offered for this webinar and future ones, or will there be lactation credits available for this class? I think, Angela, this is your turf.
Yeah, and I really thank everyone for the question. IBLC is the professional organization that provides LSERPs, and that's typically how lactation consultants redo their certifications and continue their continuing education. IBLC's stance is that a pump company or any industry company cannot provide SERPs, and so we would not be able to provide SERPs. We do offer continuing education for nurses, and so we do have a lot of people who attend our really, I hope you all think, really great webinars. But what I'm also hoping is that IBLC changes their stance on the researchers that work with us. And so even if we aren't sponsoring one of their talks, that they will be able to get SERPs through a normal channel, that maybe with a breastfeeding coalition or something to that effect. And that's my real hope, is that the research and the scientists that we work with will be able to disseminate their information to lactation consultants, regardless if it's on our platforms or not.
Thank you. And also another question, probably more of the administrative part. So basically, are there any platforms where we, the IBCLCs, can participate in our research programs?
So the research is actually separate from medical affairs. Our department that Natasha, Nanya, and I are on are the dissemination of research. So we look at the research that's been done, and then we try to create education programs, such as sponsoring at conferences so that people can hear about the research. We do have a research arm, and Leanne Matulis is our head of that, and you can request to do research with us at any time. We have some funding available for research. And of course, you know, I think some of the questions that have come up too are a little bit about the foundation. The Family Larson Rosenquist Foundation is separate from Medela. We don't have any visibility into the research that they do, but they're primarily focused researches on low and middle income countries. And so they're kind of the arm to do research in those areas, but Medela doesn't have a relationship or visibility to them in any way.
Thank you. Thank you. And then we've been asked by Elisa, and she wants to know, how does Medela believe this should be handled in the NICU, our decision with the portfolio update in the US that most infants still receive a bottle at some point? So maybe you can a little bit elaborate on this one.
I think it's a really great question, because certainly with pump dependent mothers, we know that in the NICU, many of those mothers need the breast pumps in order to initiate a breast milk supply. And so what we're basically saying with our decision is that the decision about feeding is left between the mothers and the healthcare providers that are working with them. We haven't had teats in our breast pump kits for at least 10 years, as long as I've been working in the hospital system. So that's never, in the United States, has not been something that has been promoted. We really just have our pump kits, and nothing is changing in those markets. In Europe, the teats were included, and now they will be discontinued out of the pump kits. And I know of many hospitals, I work with a hospital in Wisconsin that actually directly moves their babies from enteral feeding to direct breastfeeding, and that can happen, and we want to support that. I know another question was in the chat was about nipple shields, and of course nipple shields do help preterm babies hold on to a breast and get them moving through the system of learning how to feed at the breast and eventually direct breastfeeding. And so we know the best outcomes for babies are direct breastfeeding, and then second best to that is fresh expressed breast milk, and then frozen breast milk, and of course donor milk. And so we also need moms who have abundance milk supplies to donate to human milk banks, because our babies often need a bridge of donor milk until their moms produce a full milk supply. And we don't really make any judgment based on what the healthcare provider is seeing in practice and their decision of how they feed that baby. And so I think for us, it's just about creating supportive solutions, such as, we also have oral syringes. I know I use oral syringes all the time in the hospital with very small amounts of colostrum. We have our special needs feeders, we have cups, we have finger feeders, we have soft cups. So we have a lot of other solutions. We just think that for us and the things that we want to do, that being outside of the scope of the code. So basically, we're no longer under the regulations of the scope of the code, are really important for us advancing research and education. And that became the highest priority for us in the organization.
Thank you very much, Angela. We've also received a couple of questions regarding our stock. For example, Janet tells us that she's still seeing the Colma bottles and standard feeding bottles on Amazon, which could be delivered by July. I understand that it takes time for product supplies to dwindle, but when do you estimate that these products would be off the market? Very good question. Happy to answer. Maybe Thomas first.
Sure. As I'm probably the salesperson in this call, now the average in the retail sector, the average stock reach is 3 months. That's an average number. You can also see if you just enter it in GDP. Now we know that with the communication, as you can imagine, our products were not really something hot in the market. So I would assume that it's actually significantly less than that. But to be quite honest, we don't know. It depends on so many factors, how the retailers, in that case, I also saw the question, Amazon or any other, are promoting what kind of price policy they apply. And it's totally, and actually by law, forbidden for us to actually intervene there. But I think the mainstream will probably, for another month from now, I would guess. But please don't nail me on that one, as it's very individual, depending on the customer. Quite frankly, we saw in some pharmacies in Europe, we see products which are even 2 years old, because they didn't put them into the sales.
Thank you.
I think the important part for us is that we are no longer selling the bottles and teats, so the profits to Medela are over as of June 30th, July 1st. And so there will be time that those products are still available, but eventually there will not be products. So wherever you decide that that is your line in the sand, we hope that you understand that those are one of the things I remember Thomas saying to us is because the products are safe, there's nothing wrong with them, we can't recall them. And so we did try to stop manufacturing and then have a period of selling them. We do have a few products left. One of the questions was, were we going to save our IP for Calma and sell it to somebody else? If you want to maybe elaborate on that, Thomas.
Also not, no, it will not be sold on. There was also a clear decision by Michael Larson. We said no. I mean, we are just exiting that part of business. What other companies do, none of our business, but we are not supporting them. This is, again, I'm happy to repeat myself. It is a focus on what really matters for us.
Thank you. And then also we have been asked a question. What do you think, us as Medela and also them as advocates? How can we ensure the commitment to the code, that the commitment to the code is understood as a long-term ethical stance?
Well, I'll start. One of the things that we've done internally is we did a lot of internal education for our company employees to understand this decision, why we made the decision, what the implications are, kind of where the history of bottles and teats came from, so that people could also be sensitive to the issue. And so I think for us, it's really also about internally, everyone at Medela is super passionate. They're super passionate about supporting breastfeeding. And I think once they had more education of that, it really helped change the minds of people in the organization. And Thomas, I don't know if you have anything to add.
No, I think that is clear.
Perfect. I think we're at the end of this hour of the webinar. And I've also been scrolling through the questions. Every questions we couldn't answer so far, we will follow up by email. But I think on behalf of everybody, we would like to thank you very, very much for participating in this webinar. And with this, I give the word back to the presenters.
Yeah, the one thing I just want to really make clear is that we want to do this in partnership with all of you. If you have feedback, if you have things that you want to share with us, we are open to that. You can email any of us at any time. We do have a reporting system in place. If you see violations, we will work to remedy them as soon as possible. But thank you all for being here.
And maybe finally from my side also a heartfelt thanks. We are fully aware that this is a process, and we are also aware that we need to walk the talk, as the saying goes. But I confirm we will do that. But I also know there will be some hiccups because, as this colleague said, there will be here and there still products popping up, and probably also in a month or two from now, and the odd product even longer than that. But whatever happens, it will not alter our commitment. Thank you very much for your attention.
Thank you.
Thank
Thank
you.
you.
Thank you very much.